Open Mental Health Somerset is a visionary new way of bringing together NHS services, the local voluntary sector, along with social care to create an ongoing partnership which improves the lives of everyone living with mental illness in the local area. In the past, the working relationship between the NHS, voluntary groups and social care has resulted in outcomes which weren't always the best for people living with mental illness.
It was really hard for people with mental health needs like myself to get the support we needed. The system was broken and fragmented. We were sent to various places, had to tell our story over and over again, and because we weren't looked at as a whole person, we were told we didn't qualify. As a result, we ended up going into crisis with very serious consequences for ourselves and our families, and short-term interventions were quite ineffective because they didn't look at the larger picture, which meant we would go round and around without actually getting anywhere.
People often found themselves in a system which tried to provide a one-size-fits-all approach to mental health. This meant they would often fall through the gaps, despite there being local solutions to their problems.
I think fundamentally it was the fact that the system that we had before didn't lend itself to people working together really. So there was funding available from government, local government and national government to support mental health, and voluntary sector organisations weren't necessarily working closely enough with the NHS, and actually even within the voluntary sector itself, the system didn't lend itself to collaboration really.
So how does our new model solve this problem?
So wherever you come into the system, we will work with you to find out what your needs are and how best we meet those needs, and we'll pull people around you to meet your needs so that you feel empowered, but also you're not having to navigate a really complicated system.
So if someone comes to any part of Open Mental Health with problems around serious mental illness, loneliness, physical health problems, housing, debt, employment, low mood or addiction, we can make sure that they get the help they need to get things back on track. We'll introduce people to the right organisation to help with their needs, where they'll find expertise, peer support and empathy for their situation. The barriers between the NHS and our voluntary and charity sector have gone. We are Open for Mental Health in Somerset.